My name is Michele Saysanna. I'm a pediatrician and pediatric hospitalist at Riley Hospital for Children at Indiana University Health. I am also the medical director for quality and safety at Riley. And I just presented at the Relational Coordination Roundtable about implementing family-centered rounds and our Riley perspective.
Thanks for joining us, Michele, and thanks for your presentation today. Can you describe or summarize your work in relational coordination that led to your presentation today?
Well, we've been doing family-centered rounds at Riley for the last 4 years, and part of that was the implementation piece of it, and now the sustainability piece. We've also recently embarked on a project about improving discharge, the discharge process for our patients and families, and in that work decided to use relational coordination to measure, as a measurement tool in this work that we've done with our hospitalist patients on a particular unit at Riley.
Excellent. And from your experiences and the lessons learned that you captured in the RCRC Roundtable discussion today, what were some of the reflections that you had or that some of the group had based on your presentation?
I think a lot of the questions came sort of about how to do it and how do you implement that process. And I think the other thing I reflected on was during my presentation as I was presenting and listening to people is the sort of incredible amount of change management that went into actually doing it. And I think now that we're 4 years into it, it was easy to sort of forget how hard it was because now it's so easy. But then going back, preparing for this presentation and listening to the questions in the room, I was immediately reminded of all of those challenges that we had and how we worked through all those.
Yeah.
And I appreciate that people brought that up.
And that's a great point, having the 4 years of perspective. So based on that and your accomplishments, what are your next steps as you continue to develop relational coordination in your institution and with your patients?
I think a big piece of it now is around our other, especially with that particular group of physicians and that unit, but then taking what we've done with them and spreading it to other units. We already know that that team is a high-performing unit. I mean, they're always the early adopters. So how do we take what we've done with them and move it out to other units? We have other units doing family-centered care, so now we're looking at other initiatives like the discharge, improving the discharge process for all of our patients at Riley. We're also now involved in a big national safety collaborative, and so we're taking the work that we're doing here and using that for these different work teams that are going around working on different hospital-acquired conditions and readmissions.
Michele, thank you for your participation.
Thank you.